So my first disclaimer is that these slides are actually written by our social worker. So in our NF1 Complex Centre in Guy's, we have a very big team with different professionals, and we are very lucky to have our own social worker, Aisha. She is amazing, and I continue to be thankful that she just makes people's lives better. So unfortunately, she wasn't able to be here this morning. She's coming up for the conference tomorrow, but couldn't make it. So I will be using her slides. So if I sometimes have to read off them, that's why. Now, I also really appreciate that this is a UK-based talk, and a lot of you might have come from different countries. So apologies, you will probably have different rules and laws in your own countries, but hopefully this will at least give you some thoughts about maybe how to apply for benefits or how to look into it. But yeah, those are my disclaimers. So overview of UK welfare benefits. So firstly, welfare benefits, so what are they? So obviously, the majority of people that we work with, we want to support people to be able to, like what I was talking about before, be aware that you have something that might be hindering your quality of life, but we want to be able to support you to do as much as possible without pushing yourself. So whether that is partnering with you to still, maintain your work, and be able to do all the things that you want to do, then that's part of our role. But it's also, for some people, unfortunately, that isn't going to be possible, whether that is having to drop back to do part-time hours, or for some people, unfortunately, it means work just isn't possible for them. And so then as part of our role, is again, as nurses, we're looking after the whole person, not just your lumps and bumps, but we want to say, how is this condition affecting you, through different symptom management. That's obviously our nursing role as well. But holistically, are you able to work? How can we support you in the workplace? So, I write a lot of letters for workplaces, telling them about the Equality Act and how, they should make different reasonable adjustments for people. But unfortunately, sometimes reasonable adjustments is not enough, and people have to leave the workforce. So when they do that, there are different welfare benefits available. Again, if you're from a different country outside the UK, this might be something you're really familiar with, or maybe something you haven't looked into. I can't speak for other countries, I can only speak for the UK. But in the UK, the welfare benefit system is designed to help with the basic necessities to eligible people. And I think that's the bit where, your NF team or your healthcare team can really come alongside you to help you meet that eligibility criteria, because sometimes there can be a lot of red tape, there can be a lot of complex language that means that some people who would definitely be eligible aren't getting the benefits that they're entitled to. And so part of my role is supporting people through that process, and part of our social worker, Aisha, her role is making sure people know what they have, what they're entitled to, and supporting them to get that entitlement. So that is part of why I'm talking on this, because it is a very present part of my role. So yeah, I thought, interesting fact, research shows that £20 billion of welfare benefits go unclaimed every year in the UK. So there would be a lot of people who are eligible, but for whatever reason, they're not getting what they're entitled to. So here is a list. There's loads of different types of benefits, and that's where, when we're talking about eligibility, it might be that you've tried for one particular type of benefit and you weren't eligible, but there might be a different type of benefit you weren't aware of where you would be eligible. So it's really important to know the different types that are available and all of their different eligibilities. Lovely. So let's start for benefits people who have different forms of disability because of a health condition. So Obviously, this is very personal. I'm not going to be asking people to tell me what ones you're on, but you might be familiar with the Employment and Support Allowance. So this usually kind of goes alongside Job Seekers Allowance. So when I'm chatting with people, it might be that they're on one and switch to the other. And I'll chat about job seekers later. But it's for people who, you're not actually able to work at the moment for whatever reason. And that might be something that is a permanent state for you, but it also might be something that might change. So, for some people that I chat to, it might be that they're having a period where their mental health is really not good. And so they're on ESA because during that time, they really can't work. But with the different support in place, their mental health gets better, and then they're able to go back to work. So this, for them, is something that is a short-term benefit. But for some people, it might be a more longer-term benefit. So again, it's knowing your eligibility. So with these ones where it says under state pension age, that can change. I think at the moment it's 67. Someone might want to correct me on that one. 67? Yeah, you think it is? Yeah, I think so too. So yeah, so you need to be under 67. You need to have worked previously. You have a disability or illness that affects your work, and you paid international insurance. Now, I am quite passionate about people, again, sorry, this is UK, paying international insurance, just because unfortunately, in my role, I have come across people who hadn't paid international insurance, something has happened with the condition, and then they weren't able to get benefits. And it is so distressing. It's distressing for them. It's distressing for us as healthcare professionals who want to make their lives better. And it was just something that they'd never really, bothered too much about it. They're just like, oh, we're just working. They're self-employed, and they weren't paying national insurance. So ever since that happened, I just say to everyone, please, if you're self-employed, please make sure you're paying national insurance, because I do not want to see that happen to anyone ever again. It was awful. So yeah, this is employment support allowance. So how to get it? You do need to prove that you're not able to work. So again, it's chatting to your healthcare providers, getting information. Children's Tumour Trust, they're here. They've got great resources. Nerve Tumours UK, they've got great resources. So making sure that you've got the information about your condition. For people who, let's face it, they probably won't have heard of the condition. Time and time again, people tell me, I went to this thing, they'd never heard of it. It's so frustrating. So make sure that you have all that information so that when you're applying, you've got it all there. Personal independent payments. I'm going to run through all of these, and then I'm going to go back to this one just because it is the one I spend most of my days chatting to people about. So personal independent payments came in a couple of years ago, switching over from what was long established, which was the disability living allowance, which is still available for people under the age of 16. But unfortunately, over the age of 16, they changed it to personal independent payments. And I know that changeover was a very stressful time and continues to be a very stressful time for a lot of the people we see. Because for people who are on disability living allowance, the personal independent payment criteria was very different. And a lot of people who'd been on DLA, disability living allowance, for some of them their entire life, suddenly it got taken off them. And that was a really distressing time. And so we want to be able to support people to say, actually, if you're on DLA, you're not on it for no reason. So let's help you meet the criteria to be able to get PIP. So what is it for? It's to help with extra living cost. So it is designed to say, you have a condition that is going to, cost you more, whether that's you're having to pay to get to appointments for your healthcare condition, you're going to, have to maybe need adaptions, and that's going to cost you more. It's to help with those extra living costs of having a condition. So you have to be over 16, again, under state pension age, and have a disability or a long-term physical or mental condition or difficulties in everyday tasks or getting around lasting at least 12 months or more. So I will, like I said, we'll go through all of these quickly, and then I'm going to circle back to this one because this is quite a big one. So attendance allowance. Some people may not have heard of this one before. You have to be over the state pension age, so that's when I was looking up what the state pension age is. So if you're over 67, offers extra money to help with your personal care. So it's one that well, I don't know about you, but I don't hear a lot about it. So it's really important to share with people. If you know people over 67, make sure that they're aware that this exists. Because it's really helpful just to give you a top up of support for your day-to-day living. And then we have disability living allowance, which is for people under the age of 16. So again, helping with the extra costs because of the condition. Reduced earnings. So that is designed to help people who can't work anymore. I'll be honest, I don't know a huge amount of that one. And same with blind person's allowance. So this is for people who are sight impaired and are going to be working, which again, this is the benefit of having a social worker on our team. I'll be honest, these are ones I hadn't heard of before. And so it's been so helpful having someone who knows all the different types of benefits in our team to be able to tell us about this. And it was really good because I was able to chat to one of my patients who is sight impaired about it. Thankfully, he was already aware, but we were able to support him to get it, which was great. And then disabled facilities grant. So a lot of people get this through your local council. Is being aware that, sometimes, because of this conditions that we have, it affects how you're able to get around your house, how you're able to, navigate like the bathroom. You might need a wet room. So this grant can help you get the finances you need to be able to make those adaptations in your home. So it's very important to be aware of. Cool. So benefits for those unable to work. We've talked about ESA already. Universal credit. So universal credit really is there to pay your day-to-day expenses. So where PIP is designed to be that kind of top-up, universal credit and ESA are designed to be the benefits that will be, covering your rent, covering your living expenses, because you cannot work. And same statutory sick pay, so that is for people who are working but have been signed off work for longer than 4 days. And that, again, for some people that we work with, they start on statutory sick pay, and then when maybe things continue and they're not going to get better, that's when we need to work with people to think about, is it realistic that they'll be able to return to work? Should they be medically retired? And if so, can we support them to move on to one of the other types of benefits, like PIP, like employment support allowance. So to give an example of one person that our social worker Aisha's been working with, she has NF1, she's got long-term problems, she was working, things have gotten worse and she just wasn't able to go back to work, was on statutory sick pay, but was really, really anxious about going back to work, just felt like it wasn't going to be a possibility for her, but was really unsure how to go about that. And with statutory sick pay, after a while, you're not getting any money, and cost of living crisis as well, things were quite dire and was really affecting her mental health. So working with our social worker, they've been able to work together to get her on the higher level of PIP. And once you're on the higher level of PIP, it puts you in really good stead for getting the employment support allowance, which she now has. So it has meant that she doesn't have to go back to work, and she is being, supported financially to be able to focus on her health and to try and get as well as she can. So that's been a really positive sort of change for her, but also really good for us to see, you know, the just importance of being able to support people, listen to people, and also the benefit of having a social worker in our team. Benefits for carers. So, you know, we chat to a lot of people in our clinics who are, you know, working alongside people who have NF1 or, you know, have NF as well as in a caring role. And so it is really important of knowing what support is available for you as a carer. So yeah, there's carers allowance and carers credit. Universal credit I mentioned already. Pension credit, so for people who are over the state pension age, so over 67, on low income and having trouble to pay their bills. I hate to say this is probably very important at this time, that people are aware that this exists. So please, if you are, you know anyone who might fulfill that criteria, please let them know about pension credit. So they can get that top-up amount that they might need. And more about pension credit. So again, it helps. These top-ups and extra payments are called guaranteed credit. So that's great. And then dealing with bereavement. So unfortunately, this, you know, in our lives, we will lose people occasionally. And so really important to know what support is available if you do know someone who has passed away, that you can support their family and let them know what support is available. So there is a bereavement support payment and funeral expense payment as well. So just again, it's helpful, I think, just to be aware of what's available. It's not saying like, oh, I need to know this right now, but just know that if something happens to someone that you know, that you have this knowledge and you're able to share, you know, oh, did you know you might be eligible for these things? Because they're out there, but often people don't know about them, so they don't claim for them. Right, lovely. So now we're going to run back to Pip. Okay, so firstly, I'm just going to, I know I said I wouldn't, but I'll throw it to the room. Does anyone have any questions of Pip before I start blaring on about it? Because I will go on it for quite some time.
They are changing the name on the Pip as well.
No, are they?
Yeah, I don't know what it's going to be called, but they are changing it. It's going to be gradually changed eventually.
Classic. They're changing the name to Pip, so
I don't know what it
just
is,
to confuse us even more.
I don't, something, I can't think what it's called now. Adult.
Don't know.
Yeah, something adult is called.
Okay. Well, that's good to know. Oh, gosh. Just they're keeping us on our toes, aren't they? It's probably because it's getting such a bad rap, they've realised they've got to change it. So anything else, any comments before I dive in? Go, Claire.
One thing is being very clear yourself in how your NF. Yeah, I think when you're going for assessment, I think as well as filling out your form, be very aware in yourself of how your NF impacts you and breaking it down into, okay, I have pain, this affects my function in these areas. So rather than when you have the assessment going, well, I have NF, I have tumours, breaking it down to how it impacts your activities of daily living, what the NF is actually causing, rather than it being the NF itself, because the person assessing you, they could be a physio, they could be a nurse who's worked in elderly care. You know, so this person isn't really going to have any knowledge of NF when they come to assess you. They will just have a list of things that they need to ask you, of things that they'll ask you to do, like stand up and touch your toes. But they won't know about NF itself. So you really need to either know or have somebody with you who knows how it impacts you, and to be able to list those things rather than it being, I have NF, I have a tumour on my leg, so I can't walk. You need to say, I have pain. You know, I can't walk less than 10 metres without such and such an aid. you know, when I get up in the morning, I can't stand. You need to be able to break it down rather than just it being saying you have NF.
It's really good. It's really good. That was brilliant. Thank you. Adult disability payments. Great. Of course, they're changing the name. Does it say when? Summer 24. Okay, fab. Okay, fab. So they're literally just changing the name. Great. Good one. A rebrand. Adult disability payments coming 2024. Yeah. No. That is different. So it's a different application, but you're right. Because depending how your condition affects you, you might be eligible to go for a bus pass or a rail card, 100%. But it's different. It's a different application. More applications.
Yeah. If it was for like, say, travelling to university, if it's like for travelling to university, travelling to a place of work, there's a grant that you can get for going to, you know, for you being able to work, and your employer can help you apply for that. So that could cover your travel, it could cover use of voice dictation software or a laptop for you to use. So there are other things you can apply for, either as a student with university or for your workplace for those things. And that shouldn't have to come out of your PIP or your mobility payments.
Exactly. So I think it's really important to know, it's like there's PIP, but then there's all these other things that you can apply. So you're right, through university, there's different support, and it's really important that you're chatting to your university. But also that there is a different application if you need a bus pass or you need a blue badge. You know, those are different. So I think what Claire pointed out really, really well is that when you're going for personal independent payments, or they're changed to adult disability payments, you know, the way they do it is criteria based. And there are two parts to it. So there's the care part, and then there's the mobility part. And the thing is, when people say to me, it's like, oh, I should get PIP because I have this condition. I'm like, well, yes, but what they're looking for is, how does this condition affect you in your day-to-day function? And a lot of people might miss out on different points because it's point-based, because they haven't thought about, you know, when I'm cooking, you know, it says, you know, can cook without, you know, using an aid or appliance. Well, you might not think, well, actually, when I'm cooking, I need to sit down because my balance isn't great, or maybe if I have ADHD and, you know, maybe I do need someone else in the kitchen with me, because for me to make something safely means that I need someone around so I'm not getting distracted. You know, these are all ways that you can get extra points that you might not know. So, you know, like a chair, a stool, you know, you can count them as an aid, and that's 2 points. So there are ways of thinking about how can I get those points. There's a really good website called Turn to Us. I'm not sure if you guys have heard of it before. So Turn with the number 2 Us. And they have a benefits calculator on there, as well as the criteria for PIP. So whenever people, you know, call me and say, Mary, I need to do a PIP application, I will get out the criteria and go through it with them, so that when I'm writing a supporting letter, I can try and make sure that we cover every single base that is needed. So it's thinking about things like that. You know, then think about, you know, they say for you to be able to do it safely. And I think that's a really key point for you to say, well, you know, yes, I can, say, shower by myself, but am I doing it safely? Or actually, would it be safer for me to have a shower chair? And in which case, that is an aid, and that is an extra 2 points. So it's trying to think through, you know, yes, I do these things, but if I was applying, is this really the safest way for me to do it? And that's a really good way to kind of think how you can get extra points. I don't know if that makes sense. Is that something that people have experienced and had to sort of go through as well? yeah, it's, oh, hello.
I was just going to say it's a fantastic session, and thank you so much as well, Mary.
Oh, gosh, the time.
Obviously, time flies when we're having fun, right? So if anyone does have any additional questions linking to the PIP and benefits side of things, please do email them through, and we'll try and get back to you as soon as possible with that. So
Brilliant.
thank you
And
so much.
if you do have questions about benefits and they get emailed to me, I will forward them to Aisha, our social worker. She is way more experienced at this than I am, and, you know, is such a key person. So, you know, please do get in contact. But also turn to us. Brilliant website. Please look it up.